How does vaccine nationalism affect fair vaccine distribution? Imagine a world where some countries get all the vaccines first, while others wait in line 4 months. That's what vaccine nationalism can cause. Countries often want to protect their own populations first, especially during a pandemic. They buy up large amounts of vaccines, sometimes more than they need, leaving less for everyone else. This means poorer countries might not get enough doses for months or even years. When vaccines are unevenly distributed, it makes it harder to control the disease everywhere. From an ethical point of view, this practice clashes with the idea of justice. Justice means treating everyone fairly and sharing resources based on need. When wealthier countries hoard vaccines, they are not being fair. They prioritize their own citizens over others who might be at higher risk or have fewer resources. Equity is also affected because vulnerable populations in poorer countries face greater health risks when they lack access to vaccines. Vaccine nationalism also hurts the idea of solidarity, which is about working together to solve common problems. Pandemics are global issues that require cooperation. When countries act selfishly, they weaken international teamwork. This can make the pandemic last longer and cause more suffering worldwide. Another problem is how vaccine nationalism can disrupt supply chains. Producing vaccines involves many steps and parts from different countries. If some nations restrict exports or stockpile ingredients, vaccine production slows down. This delays getting vaccines to countries that need them most. It also makes it harder for poorer nations to build their own manufacturing capacity. Some countries rush to approve vaccines quickly to secure supplies, which can be risky. Fast approvals might overlook safety checks, leading to public mistrust. If people don't trust the vaccines, vaccination campaigns can stall and the pandemic could worsen. While some argue that governments have a duty to protect their own citizens first, this view ignores the bigger picture. Pandemics spread across borders, and no one is safe until everyone is protected. Sharing vaccines based on need and vulnerability aligns better with global health ethics. In the end, vaccine nationalism creates unfairness, slows down global efforts, and can even threaten vaccine safety. To truly fight a pandemic, countries need to work together, share resources, and prioritize those most at risk, no matter where they live. Only then can we ensure fair and effective vaccine distribution for everyone.